from CBS 4 News, this is Facing South Florida with Jim DeFede.
Good morning. Welcome to Facing South Florida. I'm Lauren Pastrana. Jim DeFede is off this week. At least 12 deaths in the U.S. are now linked to vaping, one of those here in Florida. The Centers for Disease Control says the number of cases of lung-related illnesses associated with vaping has grown to more than 800. The Food and Drug Administration is launching its own investigation into the illnesses. While the products are sometimes used by adults in an effort to quit smoking traditional tobacco products, there's a growing trend amongst kids and teens who've never smoked to pick up vaping. But what exactly is it doing to their bodies? We asked a local doctor to explain.
Vaping may cause acute respiratory distress in some patients.
Dr. Mehdi Mercedi is a pulmonary and critical care specialist at the University of Miami Hospital. He has seen and studied the effects of vaping firsthand.
What I would say is exactly what the CDC recommends recently. America, stop vaping.
The CDC says most of the hundreds of confirmed and probable cases of vaping-related illness involve vaping with THC, the psychoactive ingredient in marijuana, or both THC and nicotine. A bipartisan group in Congress is working with parents to keep teenagers away from e-cigarettes while accusing the vaping industry of marketing to kids by incorporating different flavors and brightly colored packaging.
We will not allow our children to be used as human guinea pigs.
2018 data shows that more than 20% of high school students used e-cigarettes, up 78% from 2017, and nearly 70% of those students used flavored ones.
A Juul representative came into my school and told me and my friends that the Juul was quote-unquote totally safe.
Earlier this month, the FDA issued a warning to Juul for its marketing practices, including claims allegedly made in presentations to kids at school. Juul's CEO stepped down on Wednesday, and the e-cigarette company announced it would suspend its TV, digital, and print ads. Doctors say the fine particles and carcinogens in fruit flavorings could have devastating impacts on teenagers whose lungs are still developing.
I'll never forget watching her cry that she literally couldn't breathe without excruciating pain as she was pumped full of IV fluids, antibiotics, steroids, pain meds, and a diuretic to clear fluid from her badly inflamed lungs.
Ruby Johnson's daughter was hospitalized for a week for an acute respiratory distress syndrome linked to vaping. At a congressional hearing Wednesday, the principal deputy director of the CDC told House lawmakers health officials are still trying to pinpoint the cause of the illnesses and deaths.
We have more than 100 people responding to the outbreak right now in Atlanta, as well as deployed to assist its states. And we took the step of activation to better support the state and local public health who are on the front line of this.
Now, it's important to note no single product, brand, substance, or additive has been linked to all of the cases. The CDC says its investigation is ongoing. I'm joined now by Miami-Dade School Superintendent Alberto Carvalho to discuss the impact of vaping in schools and what the district is doing to combat the growing issue. Superintendent Carvalho, thank you so much for being here with us this morning.
Thank you for the invitation.
Let's get right to the statistics off the bat. We just heard that in the last year, use of vaping products by teens and young adults has grown 20%, a huge jump from the year before. Is Miami-Dade County Schools seeing that uptick as well? And how concerning is that for you as a superintendent?
We have seen over the past few years, as a result of what I believe are unethical and immoral marketing practices, a dramatic increase in a number of students, particularly senior high school students, but younger middle school students as well, an increase in a practice of vaping. So right now, probably in our school system, much like across the country, 1 out of every 5 senior high school students had some degree of interaction with a vaping instrument over the previous or prior 30 days. That's quite alarming. I mean, we know the medical risks, the respiratory implications associated with vaping, but it goes beyond that. You know, the research is quite compelling. Nicotine is highly addictive, and the fact that there are companies unethically marketing via clever packaging and flavoring these products to students is having not only an impact on their respiratory health, but also an equally serious impact on their cognitive development. So there is compelling research that ties brain development delays with vaping and the impact of nicotine. Obviously, if your brain, particularly as a young person, is not developing adequately, the implications, short and long term, on cognitive development, the ability to learn, will also be impacted, and that's a shame.
And now we spoke also with the Broward School Board Chair, Heather Brinkworth, to find out what the Broward School District is doing to deal with vaping among students on campus. She says now over the summer, just this past summer, they instituted a new policy for this school year. Here's what she said.
Previously, we only had tobacco consequences, and electronic nicotine delivery system devices were being used in our schools, and we felt it was important that we impose some consequences. And so those consequences are different depending on the level that the student is in. If they're an elementary school student, they have a one-day detention in school, and a second or subsequent offense will get them a 1 to 2 day in-school suspension, and then a referral to a substance abuse counselor, because at the end of the day, it's important for them to understand the dangers of using those devices and how they impact them.
Let's stress that right there. She said elementary school students. Those are the consequences for elementary students. In high school, students in Broward County, a first offense will lead to a 1 to 2 day in-school suspension and a referral to substance abuse counselors. Now, does Miami-Dade have such a policy in place? Is it new? Is it sort of a work in progress as these numbers continue to grow?
We've had a policy in place for the past 20 months or so. Actually, the board was very proactive in bringing that policy that codified, in essence, the use of e-cigarettes or any type of vaping device, much like we would treat tobacco devices or traditional cigarettes, I mean. The issue here, as far as Miami-Dade is concerned, was we focused most of our attention on prevention. So we launched a very aggressive marketing campaign detailing the health risks associated with vaping. We brought in stars that are easily identifiable by the students to talk to them about the fact that they are not lab rats, that they should not succumb to the marketing strategies of these companies. But yes, there are also policies in place that specify consequences associated with the confiscation of e-cigarette devices in schools. And we've gone beyond that. So we have policy in place, we have preventive measures in place, we have counselors and nurses that we refer students to if they are using these types of products. But then we are also testing very advanced technology that could be installed in schools as early as next year that will detect the very, very small amounts or concentrations of vapor in schools. We know where students mainly use these products. They use them in restrooms. Obviously, for privacy reasons, we cannot install cameras in restrooms, but there are technologies that can detect the existence of vapors. So the deterrent effect that will have, I think, will be positive for students in Miami-Dade County Public Schools.
You bring up the restrooms and the fact that a lot of kids, because there's that lack of surveillance in those areas due to privacy concerns, they use the restrooms perhaps to use these vaping devices. I've seen on social media, not specifically pertaining to Miami-Dade schools, but some schools, some students saying they lock the bathrooms, they lock them at a certain time, they're locked throughout the day, depending on the floor of the school, and certain issues like that. And of course, that presents a safety concern as well. Has Miami-Dade instituted any sort of policy regarding the locking of bathrooms to sort of keep this at bay, or the bathrooms are open at this point?
The bathrooms are open in our school system. We do have a classroom door policy that requires all classroom doors, obviously after Parkland, to be locked. But the architectural design of most of the restrooms in Miami-Dade County Public Schools is open. So much like an airport, you have an entrance that takes individuals out of view, but there is no door that could be locked into most restrooms in Miami-Dade County Public Schools, particularly high schools.
Recalling my junior high and high school days, health class, obviously a big topic of discussion was smoking, the concerns not just with smoking, but also secondhand smoke as well. Is this something that's going to be integrated into curriculum at this point, or just sort of outside assemblies and things like that?
No, it is already incorporated into the curriculum, particularly in health classes, in physical education classes. Teachers follow standards that include the prevention, the awareness, and the dangers associated with nicotine use, however it is absorbed into the body, whether it is through a traditional cigarette or through vaping. I think we're doing quite a bit in bringing this message to the students, whether it is through teachers or an awareness campaign. But we need, quite frankly, more regulation of private sector entities on the responsible marketing of these products They are doing it specifically to target young people to develop an early addiction, and that's the part that I find unacceptable, immoral, unethical, and requires legislation at the federal level and state level to be addressed.
And the work you're doing at the local level as well. Superintendent Carvalho, thank you so much for your time.
Thank you.